Okay. So we have already seen various receptor where they are present and what are the effects of this. This table again is there, which will help you to recall the things which you have studied in ANS, that is in heart what are the receptor and what are the effect. So sinus node, AV node, that is SA node, AV node, beta 1 increases automaticity, that is which causes increase in the number of impulses, and therefore it causes increase in the heart rate. Then it acts on the conduction pathway, so increase in the conduction velocity and automaticity. It helps in again better conduction of impulses. And myocardial fibrils, beta 1 will cause increase in the contractility and automaticity. Because of that, force of contraction will increase, and thus beta 1 mediated effects are increase in the force of contraction, increase in the rate of heart or heart rate, or we call it as a positive chronotropic, positive inotropic effect. So these are the effects which are there. Then smooth muscle vasodilation, we have seen it earlier. Beta 2, again smooth muscle bronchodilation, because all muscles beta 2 are there. Kidneys, beta 1, just now yesterday only we have seen that is beta 1 causes increase in the renin release. Because of renin there is angiotensin aldosterone mechanisms are there, which we have blocked with the C inhibitor or sartans, that is ARVs. Okay. Liver causes because of this beta 2, it causes increase in the glycogenolysis and gluconeogenesis. So if there is increase in the glycogenolysis, that means increase in blood glucose, okay, or blood that is gluconeogenesis, again both are causing increase in the glucose. If we inhibit it, then there will be decrease in the blood glucose level. Then adipose tissues, beta 3 receptors are there, which causes increase in the lipolysis, and beta 2 again in skeletal muscles, they will be responsible for tremor. So these are various effects which we have seen as a part of ANS. So what will be the effect of beta agonist? So what they will cause is increase in the heart rate, increases that is positive chronotropic effect, increase in the force of contraction, that is positive inotropic effect, increase in the conduction velocity, that is also called as a positive dromotropic effect. Relaxation of smooth muscle is a beta 2. Hyperglycemia is a beta 2 effect. Then beta 2 causes increase in the release of glucagon from pancreas. Beta 2 and alpha 1 causes glycogenolysis and gluconeogenesis in liver. Beta 3 causes increase in the lipolysis. These are all effects just now we have seen, and we have seen it earlier also. So these all effects are resulting this kind of situation, and you might have studied it in again fight and flight also, because there also adrenaline, noradrenaline play important role, and whatsoever effect you might have studied earlier in fight and flight, similar effect you will be able to see over here. So what beta blockers will do, if we understand what are the effects of beta agonist, then it becomes easy to understand what are the effects. So on CVS it will cause negative inotropic, negative chronotropic, negative dromotropic effect. Because of that, it will be causing decrease in the cardiac output. If cardiac output is less, that means less amount of blood is present in the blood vessels. Less amount of blood means less blood pressure. So this is one of the mechanism it is making. It is also having anti-anginal effect. Angina pectoris, one of the disease last year you might have studied, and we may go after hypertension into angina pectoris. Okay, I had told you to go through all these diseases. Angina pectoris is because of the reduction in the blood supply to the heart muscle itself because of the coronary artery problems. So here they are helping, they are having anti-anginal effects, that is because of the ischemic heart diseases. In that it causes decrease in the heart rate. We have seen this is the effect, that is then it causes decrease in the force of contraction. So thus it causes decrease in the work by heart muscles, and it causes decrease in the oxygen consumption due to bradycardia, and due to decrease in the force of contraction. So this is how they are useful in the angina pectoris. I told you earlier that when you study hypertension, most of the antihypertensive drugs are used in other diseases also, and during hypertension, if some drugs we study, then many drugs are again used in various diseases. So beta blocker is a whole big class. We shall be seeing again at the end of these slides that how they are used in various conditions. So they are effective in arrhythmias, in angina. They are also effective in arrhythmias. They are having anti-arrhythmic effects. They decrease excitability, they decrease automaticity, and therefore they decrease conductivity of heart, and because of its all effect already we have seen how it is doing, and they are working in that way. Just a minute, hold on.